Welcome to our second topic, and actually now this is a new normal, going through our classes live and teachers there. That you continue bear with me. Today we look at our topic. In this video, we look at demand and supply, and of course, the focus is on the health products and health. The products are both the services and the products and the equipment that we buy and are used within our facilities. The objective of this lesson is that by the end of it, you should be able to differentiate demand and supply, and you should also be able to describe different health products in terms of their demand and supply. So this unit is actually designed, this topic, to give the knowledge in the area of demand and supply. I shall invite this week and next week. We have it that we need to understand the difference between basically demand and supply, because remember, this is not, we're not going to go very deep because we're not actually interested in business related. But remember, you want to be a good administrator, good manager of health related issues like facilities, programs. You need to have this knowledge, and it will help you. So when we talk about demand, what comes to your mind? I do believe that what comes to your mind is the need and ability and willingness to pay for a commodity. Need plus ability and willingness to pay for a commodity. And actually, the schedule of amounts of any product that buyers purchase at different prices during some stated time period will signify demand. So the need plus ability. Are people aware of this? Do people require it? Is it mandatory or is it a luxury? Is it is it an essential item that is needed? So it's always important that you find out about a given product before bringing it within a hospital setup or within a pharmacy, if you're working within a pharmacy or a pharmaceutical company. Now, when we talk about demand, we still mean that it's the desire people acquiring items. But what is the desire all about? Desire refers to people's willingness to own a good. So remember, I said demand is need plus ability and willingness to pay for a commodity. So willingness is the desire. You're willing, you want to, you need it. For example, for someone who is expecting, who is pregnant, she's expected to be on supplements, especially the first months of pregnancy, especially folic acid, the osteocare, which has calcium supplements. So for that, the person may be willing, there's the desire, but probably there's no ability in terms of money, because ability will basically talk about money, like how do you actually access this given product? And the need, yes, it is required because of 1, 2, 3, and the person is willing. But what about this ability? So when everything is constant, there's the need, there's the ability, and the willingness, then we call that demand. So desire refers to people's willingness to own a good, and then demand is the amount of a good that consumers are willing and able to buy at a given price. So always remember the amount of a good that consumers are willing and able to buy at a given price. Like you're comfortably able to buy at whether again, or whether it's a fixed price. As you go reach out to that given item, you are willing by yourself to acquire that given item. Now, what about supply? What is supply? Supply in our context basically still means like what is generally applied in business and economics, which stands for the amount of a good producer are willing able to sell at a given price. Is a product you're willing to let go to help other people or to be consumed by other people at a specific price or a given price, then call that supply. You are a supplier. For example, vegetables, in terms of health, we need vegetables, we need fruits, as we need food, different varied types of foods. We need the cereals, we need the legumes. And where do they come from? They come from our farms, they come from our producers, farmers. So they're like our suppliers. And you'll find that those people who buy food from them so that they can vend to us. So those vendors, once they realize there's a demand, that for us who want to consume that food, we have the need, one, because we are nutrients. Yeah. We need to be healthy. We need maybe a therapeutic diet, so we need to sickness from. Then there's the ability whereby we have money, we have access. The access power, we have money. No one is forcing us, no one is pressuring us. Probably the condition could have forced us because of health. You'll be forced to shoot. When you talk about supply, we are of a producer are willing, the producer are willing, or a good producer are willing and able to sell at a given price. So they set a given price, they're willing to sell at that given price, they sell it to the masses, and we're able to benefit. So for many people, the word market conjures up a picture of a town square with lots of small stallholders as fruit, vegetables, to meat and fish, selling the njugu karanga, selling, the cereals, selling rice, selling lentils, selling the that of a market. We think of where we're going to get those tomatoes, where we are going to buy those onions, where we are getting to get all our groceries. So for economists, the term has a much wider meaning. So it is used to describe any process of exchange between buyers and sellers. Any process of what? Exchange between buyers and sellers. Finally, the market can be defined as any set of arrangement which allows buyers and sellers to communicate and thus arrange exchange of goods, services, or resources. A free market is where such exchange occurs without interference from the government, and information is a vital ingredient for any market. So both buyers and sellers need to have access to sufficient information to allow them to make rational decisions. So both buyers and sellers, because buyers are the ones who are what? Who are demanding for the products. Sellers are the ones who are supplying to us who are buying. So we're saying that both of us need information about specific products and how they work and how we need them, how they'll help us out. Yeah, we're the one who is at that market. So according to economists, it's beyond just the stalls, it's beyond the shops, it's beyond the open markets, open places where people sit and sell. Yeah. So a market for healthcare must involve two groups. One, we have the buyers and the sellers who interact to trade healthcare. Like, hospital facilities, especially the public ones, they're purely in business. So they'll charge the consultation fee, you'll have the doctor's fee, consultation. After consulting with the doctor, you may be sent to the laboratory charges. You'll go back to the doctor after the results, you may be sent to the pharmacy. Sometimes there is no specific medication that I've sent you to the pharmacy, so they may prescribe it for you to go buy from a specific chemist or from any other chemist. So what you're saying is that at the end of the day, they're in business. So we are saying that in the area of healthcare, market for healthcare must involve two groups, that is buyers and the sellers, who interact to trade what? Health care. So whether it's treatment by injections, by taking tablets or pills, whether it is you just going to buy drugs or first aid, related items from the pharmacies. It's all about healthcare. So would the buyers and sellers be in such a market? Have you asked yourself that question? We all want good health, and so most of us will be prepared necessary to purchase medical treatment to cure an illness. This suggests that everybody is potentially a buyer, that is a consumer of healthcare. More precisely, at any moment, a buyer would be anybody who was ill or who wanted preventive medical treatment such as vaccination, or who wanted guidance about their health. Sellers will be those people who would provide medical and healthcare services such as doctors, nurses, physiotherapists, dentists, and high street chemists. That is those pharmacies where we have the dispensing chemists and the normal chemists. So I believe that you've had that difference, and given those a few examples that I've given, I believe there's something that we've been able to grasp in terms of the difference between supply and demand and what market needs in terms of healthcare. Now, in the introduction, when we're defining the word supply, we said that supply basically would mean what? Demand. Demand, we said basically it will mean what? It will mean the need plus ability and willingness. Yeah, and willingness. So with that, now what's the difference between a need and a demand? What's the difference between a need and demand? So to differentiate, we have it that you'll find that with needs, a need is someone's subjective idea because it may be based on a formula applied objectively, but the choice to use the formula was someone's subjective idea. So money is not a factor here in terms of need, but for demand, it's objectively observable as behavior in the market. So money is a key factor here, and usually demand is also called effective demand because it's expressed only by spending money. So with need, you may need, but you may not buy. But with demand, you've needed it, and then eventually you've bought it. So you've actualized, it's an objective way of observing a certain behavior in the market. But a need, we've said, it's just someone's subjective idea. So you may have an idea about something and feel it is good, yes, but then you are not actually purchasing it. But with demand, there is money, which is a key factor here. You have to plan for it and spend actually that money. Yeah. I don't believe that we've grasped the differences between the two, demand and supply, and we've now been able to differentiate between need and demand. And when you get to the markets out there, the health market out there, you should be able to differentiate all these and be in position to help others and be a good manager or administrator. But that is what we were covering today in a nutshell. I would expect that you go through your notes. We shall have more about demand and supply in our next chapter, topic 3. We shall have more about the demand curves and supply curves. So I look forward to you getting involved, getting time to watch some few videos that I'm likely to post in regards to this. But I do hope that we shall be able to grasp much content in line with the same. So I wish you well and have a good time.